Let's be honest for a second. The beauty industry is largely a racket designed to sell you scented water, magical lotions, and hope. If you've spent any time scrolling through social media, you've seen the influencers and aesthetic gurus pushing the latest $400 face cream that's mostly marketing fluff. It's nonsense. Most of what passes for skincare today is just a temporary mask for the fact that your body is losing the war against degeneration. I've spent over 55 years studying health, nutrition, and the actual biological mechanisms of the human body. I didn't get an ND, a PhD, and a DO just to tell you to moisturize. I'm interested in regeneration, the process of actually forcing your body to rebuild itself from the inside out. When it comes to microneedling, Sarasota residents have no shortage of options. You can go to a suburban med spa where an esthetician, who might have had a 3-hour course on the machine, drags a needle across your face between Botox appointments. Or you can come to a medical environment where we treat the skin as the vital living organ it actually is. The skin, when viewed as an organ, is the largest organ in the body. It does a lot more than provide wrapping to keep your insides separated from the environment. It directly interacts with the environment and communicates with every organ on the inside. If you're researching microneedling Sarasota options, the clinic you choose is the single most important decision you'll make about this procedure. The equipment, the depth, the biologics, and the supervision level are what separate a cosmetic touch-up from a genuine biological reset. At the Age Reversal Technology Center, ARTC, we don't just do microneedling. We perform physician-supervised, medical-grade skin regeneration. There's a difference, a massive one. At its most basic level, microneedling, or collagen induction therapy, CIT, is the process of creating thousands of microscopic, controlled micro-injuries in the skin using tiny, sterile needles. Now, why on earth would you want to poke holes in your face? Because your body is remarkably lazy until it thinks it's under attack. When you create these microchannels, you are sending a biological SOS to your immune system and your fibroblasts, the cells responsible for skin structure. But here's where the med spa crowd gets it wrong. The setting matters because the depth and the extras matter. Most non-medical spas are restricted by law to shallow needle depths. They're basically just exfoliating you with needles. When you choose Microneedling Sarasota at ARTC, we use medical-grade devices that reach the deeper layers of the dermis where actual remodeling happens. More importantly, we do it in a sterile, clinical environment where we can combine the procedure with supraphysiologic concentrations of growth factors. This isn't a facial. It's a biological intervention. And that distinction is exactly why Microneedling Sarasota, done at the medical level, produces results that a med spa simply cannot replicate. To understand why this works, you have to understand the difference between chronological age, the number of times you've circled the sun, and biological age, how much your cells have actually decayed. As we age, our production of type 1 collagen, the scaffolding of youthful skin, drops off a cliff. Your skin becomes thinner, less elastic, and more prone to the ravages of gravity and big food's inflammatory diet. For microneedling Sarasota patients, this healing cascade is why results continue to improve for months after your last session. Microneedling triggers a 3-phase healing response. Inflammation. The microchannels trigger the release of growth factors and cytokines. Proliferation. New tissue is built, including fresh collagen and elastin. Remodeling. The new collagen, type 3, is slowly replaced by stronger, more organized type 1 collagen. Research published in the Journal of Cutaneous and Aesthetic Surgery confirms that this process can significantly increase the thickness of the epidermis. This isn't a guess. It's biologically proven. If you want thicker, more resilient skin, you have to give it a reason to grow. Here's a more in-depth look at the collagen-producing cells that make it all happen. They're called fibroblasts. Your fibroblasts do not run at 100% capacity, making collagen 24/7 in healthy tissue. If they did, your body would rapidly turn into a solid block of scar tissue. Fibrosis. Instead, they exist in varying states of metabolic slumber until a mechanical or chemical alarm triggers a massive upregulation of collagen synthesis. For most modern people, various stressors have compromised both their microcirculation, which feeds nutrients to the fibroblasts, and their mitochondria. This, of course, leads to suboptimum collagen production, a deficit that coincides with the steady decline and degeneration of all the body's tissues, including the skin. Baseline homeostasis, the sleep mode fibroblast, in undamaged resting adult tissue. The majority of your fibroblasts are in a quiescent, dormant state, sometimes referred to as fibrocytes or quiescent fibroblasts. The baseline capacity, they are not completely shut down. They perform low-level, steady-state maintenance of the extracellular matrix, ECM, producing just enough collagen, elastin, and hyaluronic acid to almost replace old, degraded structural proteins. As with any compromised tissue or cells, they are unlikely to maintain things in a pristine state. The energy grid, in this state, their metabolic activity is incredibly low. They are essentially clocking a passive maintenance shift, conserving energy until an insult to the tissue grid requires an active response. The microtrauma alarm, the transition to myofibroblasts. When you introduce microtrauma, whether via microneedling, laser resurfacing, intense resistance training, or targeted acoustic waves, you shatter this baseline piece. The physical tearing of the matrix and the sudden release of inflammatory signaling molecules, specifically TGF-beta and PDGF, trigger an immediate phenotypic switch. The wake-up call, the resident dormant fibroblasts morphologically transform. They swell, build an internal scaffolding of contractile proteins, alpha-smooth muscle actin, and become highly metabolic myofibroblasts. The collagen factory, these newly activated myofibroblasts do not pace themselves. They immediately begin pumping out type 3 repair/structural collagen at an exponential rate to patch the breach, which is later remodeled into dense, organized type 1 collagen. This is the immediate stimulation phase of the Wolverine healing protocol. The local workforce is already on site. They just needed to be shocked into an active state. The next level, enhance the stem cell reservoir, the reinforcements. While resident fibroblasts handle the immediate emergency, they have a limited replicative lifespan and can become senescent, exhausted over time. When microtrauma occurs, tissue-resident stem cells are recruited to expand the local workforce. Mesenchymal stem cells, MSCs, and parasites nestled around the local capillary walls are parasites and resident MSCs. The stress signals from the microtrauma command these stem cells to proliferate and differentiate into brand new, youthful fibroblasts. The challenge of aging stem cells. Older stem cells are far less active and restorative than young, zero-age, umbilical cord-derived stem cells and the exosomes they contain. When young umbilical-derived regenerative substances are added to your system, they help upregulate and renew your old stem cells, serving like a software update and an engine tune-up by transferring mitochondria to the older cells. The reinforcement flow. This ensures that the tissue doesn't run out of structural factors during prolonged remodeling phases. These newly minted fibroblasts join the resident workforce to sustain long-term collagen deposition. If microneedling is the injury signal that calls for help, nano-PRP or exosomes are the elite rescue squad that shows up with all the supplies. At ARTC, we don't just use microneedling alone. We often pair it with liquid gold, growth factors, and complex proteins and peptides derived from placental tissue and / or stem cell-derived exosomes applied directly into the microchannels we've created. According to research on PubMed examining growth factor combinations with microneedling, pairing such growth factors with microneedling leads to faster healing times and more significant improvements in skin texture and homogeneity compared to microneedling alone. Why settle for just the needles when you can deliver the biological fuel that maximizes the result? This is the core reason microneedling Sarasota patients who come to ARTC consistently report dramatically better outcomes than those who went elsewhere first. Most clinics look at a wrinkle and see a wrinkle. I look at a wrinkle and see a systemic failure of cellular repair. This is why we developed the Wolverine Healing Protocol. At ARTC, we don't believe in spot treatments for health. Although if that's all you want, we will accommodate your choice. It is your body. But think about this. If your skin is failing, your internal systems are likely struggling too. The Wolverine Protocol is our proprietary approach to maximizing your body's healing potential by combining systemic support, nutritional optimization, and hormonal balancing. Cellular signaling using nano-PRP and stem cell concentrates like exosomes, enhanced oxygenation, utilizing tools like EWOT, exercise with oxygen therapy, and HBOT to ensure your blood can actually deliver nutrients to the skin. When you get microneedling Sarasota style at ARTC, you aren't just getting a procedure. You're entering a system designed to make you more like the comic book character, capable of rapid, efficient repair. Microneedling isn't just for people who want to look younger, though it's great for that. As a versatile tool for structural skin repair, Microneedling Sarasota at ARTC addresses a wide range of conditions. We use it for fine lines and rhytides, wrinkles, especially around the eyes and mouth. Acne scarring, forcing the skin to smooth out those pitted reminders of your teenage years. Loose, sagging skin, classic collagen deficit. Significant improvement is possible, though it can take several months to fully manifest. Hyperpigmentation, breaking up excess pigment and encouraging even tone. Enlarged pores, strengthening the skin's tightness to reduce pore visibility. Hair loss. When used on the scalp, it can trigger dormant follicles, especially when paired with our hair restoration protocols. Forget the cucumber slices and the whale music. Here's exactly what a microneedling Sarasota session at ARTC looks like. Real medicine, real protocol. Consultation. I, or one of my trained clinical staff, will evaluate your skin and your overall health goals. We aren't just looking at your face, we're looking at your biology. Preparation. We thoroughly clean your skin, then perform the procedure as gently as possible while reaching the necessary depth. It isn't painless, but it is very tolerable. We used to apply topical anesthetics, and most offices still do. However, research indicates this dramatically blunts the results as the anesthetic damages and degrades the biologic substances. We still use it for basic microneedling when biologics aren't being used. The pain is minimal, but you will feel it. No pain, no gain. The procedure. We perform the microneedling with precision, focusing on your specific areas of concern. The extras. This is where the magic happens. We apply the nano-PRP or stem cell concentrates, ensuring they penetrate deep into the dermis. Recovery. Your skin will look like you have a mild sunburn for 24 to 48 hours. This is a good thing. That redness is the sound of your immune system waking up and getting to work.